My name is Danielle McMillan, and my presentation is on how much minorities and women can trust medicine today. But before I dive into that, let's look at a case from the past where minorities were unfairly taken advantage of for science. With a quick Google search, multiple studies have been done specifically on Black or enslaved individuals. The Tuskegee syphilis study is a very popular experiment when discussing this topic. It happened fairly recently, ending less than 60 years ago, so most of our grandparents and some of our parents were alive when this was still going on. It is also very infamous because not only did this experiment continue after a cure was found, denying the victims treatment, but no informed consent was collected by any of the victims. The Tuskegee syphilis study was composed of about 400 Black men. Most were poor, formerly uneducated sharecroppers who were working to pay off debts. The doctors lied to these men from the beginning. To find out if they had syphilis, a lumbar puncture had to be done. Most people would not subject themselves to this solely for diagnostic reasons, so the doctor lied to the victims and told them that they were getting free spinal shots. No part of this experiment was consensual or ethical. The lead doctor was not only racist, referring to the Black population as darkies, but his goal was for everyone involved in this experiment to die because his numbers only counted if they could get a post-mortem specimen. In 1947, there was rapid treatment of syphilis across the country, but the doctors refused to treat the victims that were a part of the study. There were many other injustices that took place in this trial, but no one ever said anything. Physicians and scientists all around the world were reading the journals and articles that the doctors were releasing. These documented what was going on in this study for years, and no one questioned the ethical side of what was being done to these Black men. The Tuskegee syphilis study is just one example of how the science community takes advantage and deceives minorities. The class recently had to write a paper on the presence of structural racism in Suffolk County. One of my main focus points was the vast difference in the mortality rate of Black women while or shortly after giving birth compared to that of white women. As a Black woman myself, not only do I know many other Black women who have experienced a health professional disregard what they are telling them they are experiencing, assumptively based on the color of their skin, but I have also experienced this. I was in a really bad car accident that led to me having to undergo multiple surgeries. All but one of my surgeries were performed by the same surgeon, so you would think that we would have a rapport with one another. After what was supposed to be my last surgery, I was experiencing a problem for months, but I was told that my knee should be working fine with little to no problems. I made an appointment and brought the problem up to the physician assistant that I had been seeing since the car accident. I even showed her what was going on. She agreed that my knee was in fact not fully fixed, and she went to consult with her boss, my surgeon. She came back in the room and told me that he said that there is no way that my kneecap is shifting. He performed the surgery himself and he did not miss anything. He made this statement without even coming to see what we were referring to. I asked the physician assistant, "But you see it, don't you?" And she said yes. It is very clear that there is nothing holding your kneecap in place. And she suggested that I proceed with another surgery. At your post-operative appointment, you are always supposed to meet with the surgeon so they can look at the surgical site and have a quick chat about how everything went and what is to come. He was not present for any appointment following my surgery. This is a surgeon that has been praised about his dedication to his patients to me directly by his peers. Yet while they are telling me how much he cares about his patients, all I can think about is how he completely disregarded what I was experiencing solely based on the fact that he performed the surgery himself. Now, there is no proof that the surgeon made this decision based on my race, gender, or even age. This could just be another orthopedic surgeon with a big head that thinks he can do no wrong. But this set a precedent for me. I will always need to push harder and stand up for myself because there will not always be a physician assistant there that can advocate for me. This is something that people of color struggle with on a daily basis. In my paper, I discussed a 2016 study that was done on medical students to assess racial attitudes. Half of white medical students and residents held founded beliefs about intrinsic biological differences between Black people and white people. These false beliefs were associated with assessments of Black patients' pain as being less severe than that of white patients. This ended with less appropriate treatment decisions for Black patients. Not only is this embedded in the system, but it is unconsciously embedded in the individuals that are supposed to be helping us. Although the discrimination and bias is not always as blatant as it was in the past, it is still going on. Unfortunately, minorities will always have to have their guard up when seeking help from medical professionals. Personally, I do not think anyone should blindly trust a medical professional, and in my opinion, people should seek a second opinion and do their own research when seeing medical professionals, regardless of race, gender, or age. It is clear that minorities and even women in some cases cannot fully trust medicine today. As a future doctor, this does not mean do not go to the doctor. This simply means ask more questions, get a second opinion, always advocate for yourself, and educate yourself on what you're being diagnosed with and what you are predisposed to. Cultural competency is also very important when discussing trust. Many minorities avoid seeking medical help until it's too late because they do not want to be seen as another stereotype. Cultural competency encourages doctors to consider cultural factors that may influence health, behaviors, and beliefs. This helps improve communication and trust between patient and provider. It is very important for providers to be aware of the demographics of the area that they are working in. This will help medical professionals recognize and reduce discrimination and bias. Increasing representations is another way to enhance trust in the medical field. Diverse healthcare teams make way for different perspectives. Research shows that patients often have better health outcomes when treated by diverse providers. One of the first questions when visiting a doctor's office with multiple providers is, do you have a preference on what kind of provider you would like to see, male or female? This shows that the majority of clients prefer to be seen by a specific gender, making the choice vital in terms of comfortability. One of the most important things in being comfortable with your provider, the more comfortable you are, the more honest you will be. Pre-medicine programs, medical schools, and jobs need to implement unconscious bias, racial equity, and anti-racism courses and training with continuing education course requirements. Most people do not think that they discriminate against people based on their race. But racism has been entrenched in our country since it was colonized, and it will continue in every aspect of our lives if we do not actively work to change it. This starts with recognizing that there is a problem, followed by identifying how to avoid having a bias with your patients. This will help create a more respectful and comfortable environment for your patients. The National Institutes of Health, or the NIH, has established some new policies that increase the diversity in medical research. One example is the NIH Inclusion Policy, which requires that all NIH-funded clinical research must include women and members of racial and ethnic minority groups and their subpopulations. Exclusions must be justified. Even though medical research can be exploitative, like the Tuskegee syphilis study, trials can also be very beneficial for consenting participants. Widening the demographics of participants in studies ensures that research findings are generalizable to the entire population and not just a small subset.